It's 2:47 in the morning. You wake up with crushing pressure in your chest. Your left arm goes numb. You can't catch your breath. You reach for your phone, but your hands are shaking. You're completely alone. And in this moment, you have exactly 60 seconds to make the decisions that will determine whether you live or die. Here's what most people don't know. Approximately 90% of out-of-hospital cardiac arrests are fatal. That's over 250,000 Americans every year who never make it to the hospital. But here's what's even more shocking. When bystanders witness a cardiac arrest and take immediate action, survival rates jump to 15.4%. That's 3 times higher than doing nothing. The difference? Knowing exactly what to do in those first critical seconds. In the next 13 minutes, I'm going to share 8 scientifically proven techniques that could save your life when you're completely alone during a heart attack. But first, I need you to do something. Drop a comment right now telling me your age and where you're watching from, because what I'm about to share could be the difference between life and death for you or someone you love. Before we dive into the 8 life-saving steps, you need to understand something critical. Heart attacks don't happen like they do in movies. There's no dramatic chest grab, no screaming, no falling to the floor. The reality is much more silent, much more confusing, and much more dangerous. According to the American Heart Association's 2025 statistics update, over 605,000 people experience their first heart attack every year in the United States. The average age? 65.6 years for men and 72 years for women. But here's where it gets critical. Out-of-hospital cardiac arrest survival to hospital discharge is only 10.2% overall. That means nearly 9 out of 10 people don't survive when they're alone. And time is everything. For every 30-minute delay in treatment, mortality risk increases by 20%. Heart muscle damage can become permanent in just 30 minutes without treatment. But before I give you the 8 steps, you need to know how to recognize when a heart attack is actually happening. Your body gives you warnings, but they're not what you think. And in seniors over 60, symptoms can be subtle or completely atypical. Warning sign number 1, chest discomfort. This is pressure, squeezing, fullness, or pain in the center of your chest. It lasts more than a few minutes, or goes away and comes back. It's not a sharp stabbing pain. It feels like someone is squeezing your heart from the inside. Warning sign number 2, discomfort in other areas of the upper body. This includes one or both arms, the back, neck, jaw, or stomach. In women especially, jaw pain is incredibly common and often mistaken for dental problems. Warning sign number 3, shortness of breath. This can occur with or without chest discomfort. You're sitting still, you haven't climbed stairs, but suddenly you can't catch your breath. In seniors, this is often the primary symptom, not chest pain. Warning sign number 4, breaking out in a cold sweat. You start sweating cold, even if the room is cool. This is often accompanied by nausea or vomiting. Many people mistake this for the flu or food poisoning. Warning sign number 5, lightheadedness, unusual fatigue, or sudden confusion. If you suddenly feel dizzy, like you're going to faint, or experience extreme exhaustion without any reason, that's a red flag. In seniors, these atypical symptoms are often mistaken for normal aging. Here's what's critical. You don't need all 5 signs at once. Having just 2 or 3 is enough to suspect a heart attack. And if you have risk factors like high blood pressure, diabetes, high cholesterol, or a history of smoking, just one of these signs is enough to act immediately. Now, let's get to what you really need to know. The 8 steps that could save your life. Step number 1, call emergency services immediately. Do not wait it out. The very first and most critical action when you feel the signs of a heart attack is this. Call 911 immediately. Do not wait. Do not second guess. Do not tell yourself it's probably just indigestion. Here's why this matters. When a 911 responder witnesses a cardiac arrest, the survival rate is 18.2%. When a bystander witnesses it and takes action, it's 15.4%. But when people delay calling, survival drops to just 10.2%. The problem is that many seniors wait. They don't want to bother anyone. They think they can tough it out. They tell themselves, it's probably nothing. But cardiologists have a phrase for this. Time is muscle. Every minute you wait, more heart cells die, and the less chance you have of walking out of that hospital alive. So here's exactly what you do. The moment you feel those symptoms, pick up your phone and dial 911. When the operator answers, give your complete address immediately. Your street name, house number, apartment number if you have one, and any gate codes or special entry instructions. Say something like this. My name is, state your name. I'm at 132 Oak Street, apartment 3B. I'm having chest pain and trouble breathing. Then answer their questions calmly and clearly. And whatever you do, don't hang up until they tell you to. But while you're waiting for help to arrive, what you do next can keep your blood moving and buy you precious minutes. Step number 2, chew an aspirin immediately. Not swallow, chew. Here's why this matters. Heart attacks happen when a blood clot blocks blood flow to your heart muscle. Aspirin works by thinning your blood and stopping that clot from growing larger. The ISIS-2 study, one of the largest cardiac studies ever conducted, found that taking aspirin during a heart attack can significantly reduce mortality. But here's the critical part most people get wrong. Chewing aspirin achieves 50% platelet inhibition in approximately 5 minutes, compared to 12 minutes when swallowed whole. And it reaches 90% platelet inhibition within 13 to 14 minutes, versus 25 to 26 minutes for whole tablets. In a situation where every second counts, those extra minutes can save heart muscle and save your life. Current guidelines recommend at least 162 milligrams should be chewed for maximum rapid effectiveness. That's 2 81 milligram tablets, or 1/2 of a 325 milligram tablet. Chew it completely, even if it tastes terrible. Important warning: if you're allergic to aspirin, have a bleeding disorder, or your doctor has specifically told you not to take it, skip this step. But for everyone else, keeping a bottle of uncoated aspirin in an easy-to-reach place is one of the smartest emergency precautions you can take. Now, once you've called 911 and chewed that aspirin, your next move is about positioning your body correctly. Step number 3. Sit upright with back support and loosen all tight clothing. When a heart attack strikes, every movement you make affects how much strain your heart must endure, and your position matters more than you think. Sitting upright with back support is the best position during a heart attack. It reduces heart strain, improves breathing and oxygen flow, relieves chest pain, and lowers risks like choking or falls. Here's what you need to do. Find a chair or sofa with back support and sit at about a 45-degree angle. Don't lie flat on your back. Lying flat worsens symptoms by increasing blood return to the heart, compressing your lungs, and promoting fluid buildup. Lean back against the wall or use pillows. Keep your knees bent with your feet flat on the floor. This position helps gravity assist blood flow and eases diaphragm expansion for better oxygenation. Next, immediately loosen any tight clothing. Undo your belt, unbutton your collar, remove any tie or scarf. Restrictive clothing reduces blood flow and makes breathing more difficult. Now, here's where things get interesting, because step number 4 is something most people have never heard of, and it could save your life. Step number 4. Unlock your door and turn on every light in your house. This might sound strange, but listen to this. EMS delays, including those from locked doors, significantly worsen cardiac arrest outcomes. Think about it. Paramedics arrive at your home, but they can't get inside. They have to break down the door, waste precious time, and by then, it might be too late. So here's what you do. The moment you feel heart attack symptoms starting, walk to your door while you still have strength and coordination. Unlock it. If possible, leave it slightly ajar. This simple action eliminates barriers and buys back time you cannot afford to lose. Every second counts when your heart is failing. Next, turn on every light in your house. Why? Because a house with all lights blazing stands out immediately to paramedics. It helps them identify your home faster, especially at night. If you live in an apartment, call your building's front desk or security after calling 911. They can meet the ambulance and guide them to your exact location. This can save critical minutes in high-rise buildings. Now, with your door unlocked and help on the way, step number 5 is about keeping your body stable. Step number 5, practice controlled breathing. Inhale for 4 seconds, Exhale for 6. In the middle of a heart attack, panic is your worst enemy. When fear takes over, your body releases a flood of stress hormones like adrenaline. This raises your heart rate, spikes your blood pressure, and makes your struggling heart work even harder. Here's exactly how to do it. Place one hand on your stomach, not your chest. Inhale slowly through your nose for a count of 4, feeling your belly rise. Then exhale gently through pursed lips, as if you're blowing through a straw for a count of 6. The longer exhale is crucial. It activates your parasympathetic nervous system, which slows your heart rate and reduces the oxygen demand on your heart muscle. This breathing pattern does 3 critical things. First, it maximizes oxygen absorption in your lungs. Second, it reduces your heart rate and blood pressure. And third, it helps prevent hyperventilation-induced spasms in your coronary arteries, which can make a heart attack worse. The key is to practice this technique when you're healthy. Studies show that slow, deep breathing at 6 breaths per minute for 10 to 30 minutes daily can significantly reduce blood pressure over time. So, when an emergency happens, your body already knows what to do. Step number 6. Send a brief text message to your family members. Do not make phone calls. Here's why this matters. Talking on the phone involves effort, and that effort can worsen your condition. Instead, send a brief, direct text message. Something like this. Having heart attack symptoms. Called 911. Going to, say hospital name. Don't worry, meet me there. And here's the critical part. Don't send it to just one person. Send it to 2, 3, or more family members. This way, you ensure someone sees it, even if another doesn't respond immediately. If you have a family group chat, use that. One message reaches everyone at once. And if you can, include your exact location in the text. If you have a medical alert device, press it now. These devices connect you directly to emergency services and can provide your medical history to responders. But here's the key. You need to be wearing it. Studies show that 31% of seniors who own medical alert devices aren't wearing them when they have their cardiac event. Now, step number 7 is about staying calm when your body wants to panic. Step number 7. Stay as calm and still as possible. Do not move around. When a heart attack strikes, your first instinct might be to move, to pace, or even to try and walk it off. But that instinct can be deadly. A clinical study in the European Heart Journal found that minimizing exertion during acute coronary episodes reduced complications and improved outcomes. In plain terms, seniors who stayed calm and still had better survival rates than those who moved around in panic. Here's why. During a heart attack, blood flow through your coronary arteries is blocked or severely reduced. Movement demands more oxygen from your heart muscle, but with its supply cut off, that extra demand only increases damage. So once you're in position, once you've made your calls and sent your texts, your job is simple. Stay still, breathe slowly, and wait for help to arrive. Tell yourself, I've called for help. My only job now is to stay still and breathe. This mindset prevents rash decisions like trying to walk to the door or grab something across the room, actions that can trigger collapse before help arrives. And now we come to step number 8, the one that could make all the difference. Step number 8. Keep emergency information visible and accessible. Here's something most people never think about. When paramedics arrive, they need to know your medical history immediately, what medications you're taking, what allergies you have, and what conditions you've been diagnosed with. But in the chaos of a cardiac emergency, you might not be able to communicate clearly. You might be confused, disoriented, or even unconscious. So here's what you need to do right now, today, before an emergency happens. Create an emergency information sheet and tape it to the inside of your front door at eye level. Include your full name, date of birth, all current medications with dosages, known allergies, medical conditions, emergency contacts with phone numbers, and your doctor's name and phone number. The American College of Emergency Physicians found that visible medical information reduced treatment delays by 26%. That's because paramedics can start the right treatment immediately without having to guess or wait for family members to arrive. Keep copies in your wallet, on your refrigerator, and in your car. Update it every time your medications change. This simple step could save your life. These 8 steps could save your life. Let me recap them one more time. Let's recap the 8 life-saving steps every senior must know to survive a heart attack alone. Step 1. Call 911 immediately and give your address clearly. Don't wait, don't hesitate. Step 2. Chew at least 162 milligrams of aspirin. That's 2 baby aspirins or half a regular tablet. Step 3. Sit upright with back support at a 45-degree angle and loosen all tight clothing. Step 4. Unlock your door and turn on every light in your house. Step 5. Practice controlled breathing. 4 seconds in through your nose, 6 seconds out through pursed lips. Step 6. Send a brief text message to multiple family members. Don't make phone calls. Step 7. Stay as calm and still as possible. Movement increases heart strain. Step 8. Keep emergency information visible and accessible at your front door. These 8 steps could be the difference between life and death. But here's what's equally important. Practice these techniques now, when you're calm and thinking clearly. Run through the breathing exercises daily. Check your aspirin supply monthly. Create that emergency information sheet today, not tomorrow. And share this video with every senior you know. Remember, out-of-hospital cardiac arrest has only a 10.2% survival rate. But when people know what to do and act immediately, that number jumps to 15.4% or higher. Knowledge and preparation can dramatically improve your survival odds. Now I want to hear from you. Drop a comment below telling me which of these 8 steps surprised you the most. And if you found this information valuable, hit that like button and subscribe so you never miss life-saving content like this. Share this video with your parents, your grandparents, your neighbors, because the life you save might be someone you love. Stay safe, stay prepared, and remember, knowledge is power, especially after 60. Thanks for watching.